Bloomberg. So technology, once again, in focus, and it's also in focus when it comes to the future of the Canadian healthcare system. Obviously, a lot of people have to be patient when waiting their turn. Our next guest is looking through their business to take more control over that process, shifting in part from traditional healthcare barriers by getting access to prescribers and avoiding long pharmacy wait times. Anton is the founder and CEO of Rocky Health and joins us here in studio. Thanks very much for being with us.
It's great to be here, John.
Obviously, a lot of Canadians know about the patience needed for our healthcare system, and it's great that we have such robust healthcare, but everybody's hearing about technology and AI and all these opportunities to do things more productively. And that's part of what you've been exploring in the growth of your business and this theme of telehealth. Can you just tell us a little bit more about how the business works?
Absolutely. So at Rocky, our mission is to offer end-to-end care to Canadians by really making high stigma, high barrier issues more accessible across really every part of Canada. One of the things that we really notice, and I think it's important for us to recognize that as Canadians, we're very fortunate to have access to one of the best healthcare systems in the world. But at the same time, we can recognize that our system can be overwhelmed at times. And that really presents itself in two major themes: inaccessibility and inconvenience. In fact, 4.7 million Canadians report not having a primary healthcare provider. And it takes about 4 to 6 minutes to be able to get a first-time appointment with a GP. So ultimately, what we're looking to really solve for is bridging that gap and really lessening the burden on our healthcare system where we can.
Because it feels, I mean, this is sort of anecdotal for me, but it feels like your doctor is the first stop towards being able to look for those other options or accessing those other options. So if that process is relatively slow, it can mean that you don't necessarily quickly get access to other areas. So with respect to the kinds of things that you're looking to give Canadians more access to, what have been the sort of the priority areas for Rocky?
So we focus on high stigma, high barrier issues, as I mentioned.
Yeah.
Things like sexual health, mental health, weight loss, and many others. And really our thought process is we focus on issues that can be resolved through telehealth. And ultimately that removes some of that burden on the primary care system so that we can focus on the more complex issues that require in-person care.
And how does that work? Like, what's the process of working with Rocky like?
So ultimately, you're able to come to our platform, create your profile. From there, you complete a medical consultation. You're then matched with a clinician in an area that you reside in. That clinician will then go through an entire process with you to ensure that the medication or the issue that you're suffering from, it's the right clinical fit. If it is, then a prescription is issued, and then you get to select a pharmacy to send your prescription to. If you select Rocky's Pharmacy, we will then package and then deliver that medication to you. And then from there, we have basically monthly follow-up consultations.
Interesting. And how does the technology aspect factor into what you're thinking you could potentially do longer term? Obviously, you've identified areas that hopefully can be addressed through telehealth. But we speak so much about AI, or even today, once again, in the world of stocks, everybody's talking about AI. I would imagine a fast-growing number of Canadians very quickly take to online platforms to just try to get a little bit more context on what they're navigating through AI. So how do you think about implementing technology into this process? What have you learned on that front?
Ultimately, technology is here to assist in both creating a seamless experience for the patient and for the prescriber. And that's truly something that we're seeing improve over time with more technology coming to market. So that's really our focus, is just making that experience as seamless and frictionless as possible for both the patient and the prescriber. And
what was the catalyst for you starting Rocky in the first place?
Well, ultimately, we just saw the data, and the data really stood out to us in that, since 2020 and the advent of COVID, telehealth was a really needed service. And for us, it just made a lot of sense for us to really start servicing Canadians in a way that was conducive to the issues that they were facing.
And what's some of the feedback you've been getting from people who use Rocky, just on, you had this vision and then ultimately you start executing, and then what do you hear from the people who use it?
Well, I think that's probably the best part of what we do, right? We get to talk to our patients and understand how our service is affecting their lives. And in many ways, it really is category specific in terms of the service that they're using. When we look at GLP-1s, they're really solving a big issue. When we look at the numbers around obesity, for example, it affects 1 billion people worldwide and 9 million Canadians today. And people tend to have this misconception that GLP-1s are a cosmetic intervention. They're not. It's the last line of defense in that major issue. And ultimately, people who suffer with obesity tend to have comorbidities and poorer health outcomes. So for us, being able to solve that on the front line and reduce some of that burden off the healthcare system is really, really important.
And I would imagine the adoption of those types of treatments, I mean, you just look at the numbers, it looks like that's going to continue to be sort of something that people are asking questions about. Absolutely.
Yeah. And one of the things that is really exciting is we're going to be seeing a generic semaglutide coming to the Canadian market in the new year. What that ultimately means is 50% or more reduction in cost, which is one of the biggest barriers today in Canada, and ultimately access to all Canadians who need this medication.